4 News Now is your vaccine information headquarters. Limited vaccine doses in Washington are mostly going to white people and richer communities. The State Department of Health's new equity report shows Hispanics and other minorities are disproportionately receiving fewer vaccine doses. Maher Kawash explains what the state is doing to fix that.
For months, the Washington Department of Health and Governor Inslee said vaccinating underrepresented communities would be one of their top priorities. But as the state nears 1 million vaccinations, it's clear that Hispanics and other minorities are not getting enough of these shots. As the number of vaccinations increase in Washington, so does the racial divide in public health.
The COVID-19 pandemic has exacerbated all of these health inequalities.
Those health inequalities are front and center in Washington's vaccine rollout. The state has given at least one dose to about 750,000 people, and roughly 195,000 are fully vaccinated. Now, 65% of those 195,000 people are white. You could see the disparity among different races, and Hispanics specifically. They make up 13% of the state's population, but just about 6% of Hispanics have been vaccinated.
This is not a Washington state-only phenomenon. This is a phenomenon that's being repeated across the country.
Dr. Shaw says mass vaccination sites like the Spokane Arena are one way of solving this problem. But it's a tough system to navigate if you don't speak English or have access to a computer. The Spokane Arena scheduled 4,000 appointments this week, and 3,000 of them went to people signing up online. The other issue is that many of these underrepresented communities just don't trust the vaccine or public health at all.
There's a long history of distrust, and it's very justified.
Celestina Barbosa-Liker and her staff at WSU research racial disparity in public health. They've partnered with the NAACP to get the message out to those communities with signs like this, trying every avenue to build that trust.
Even if we have the vaccine, if people don't feel comfortable getting the vaccine, we won't be able to immunize them. So we have built that bridge to make sure that that conversation is happening.
Spokane Regional Health plans to rely on faith-based organizations, mobile health clinics, and other facilities to bring the vaccine to rural communities. But internet reliability is an issue in those communities as well. Vaccine clinics like one set up at the MLK Center in Spokane this month may help that, reaching these communities where they live instead of expecting people to come to them. Reporting in Spokane tonight, I'm Maher Kawash, 4 News Now.